We're going to take you live now to Perth, where WA Health is providing an update on coronavirus.
Died overnight. He's obviously, our condolences are with his family, and unfortunately he's the first death we've had from coronavirus in Australia.
Can you tell anything about his condition, about his wife?
So his wife remains stable in hospital. She's obviously she had the opportunity to obviously talk to him prior to his death, but she's obviously understandably quite upset, and I've obviously asked that people, respect their privacy.
Does this change anything for the status of coronavirus now in Australia and in WA?
It doesn't change anything for the status of coronavirus. We always knew that this as a disease could be a very serious disease, particularly in those who were the more elderly and those who had chronic conditions. And unfortunately, as it has in this case, this gentleman has passed away.
He was immediately put in isolation in Sir Charles Gunner Hospital. Is there any concerns about any risk of exposure between the Diamond Princess and yesterday?
No, he was obviously he was identified very early on. When he was on the flight back from the Diamond Princess, he was put in isolation, was transferred to us, and it was obviously placed in isolation on his arrival. And he's been managed in isolation ever since. So there's no risk to the general community or to staff.
Was the man caring for him? Sorry. Health staff caring for him, you're confident there?
Yep, I'm very confident there. He was in a negative pressure room and then in intensive care, and they were obviously very confident the protective equipment they were using was more than adequate.
How many days from his diagnosis to death?
It's always, well, from diagnosis, he was diagnosed whilst he was in Howard Springs, and it's about, which I think is now 10 days ago.
Obviously the situation on the Diamond Princess was pretty unique, but was he medically vulnerable, I suppose, for want of a better word?
Look, I think anybody who, he was obviously in his late 70s, like many people who at that age, they're more likely to have other chronic conditions, and they will obviously make being able to fight off this virus a bit more difficult.
So was this man immunocompromised? Did he actually...
I'm not going into the details of his illness, other than to say that unfortunately he passed away from the coronavirus this morning. That's correct.
His wife is stable today?
His wife is stable. As you're aware, she was diagnosed a couple of days ago, and she's currently stable at this stage.
Has any other family been able to visit them and her?
So my understanding is that they were able to talk to him last night, and either by phone or through the glass on the isolation unit.
And what about her? Because I imagine she'd be in a distressed state today. Are family able to look after her in any way?
The hospital, we will obviously continue to work with the family to ensure that they get all the support that they require in this very tragic time.
When exactly did this gentleman pass away?
He passed away in the early hours of this morning.
Was he in ICU or in one of the isolation chambers?
He was in our intensive care unit.
Is there any in the intensive care unit? Was he near?
There are. Again, we can isolate patients within our intensive care unit, so there's no concern for other patients.
This gentleman's death inevitably will raise public alarm, though. Are you concerned about that and about the prospect for public panic?
Look, I'm obviously concerned about people panicking. I think we still need to make the point very clear that there isn't community spread within Australia. This very tragic case is still related to the Diamond Princess. There isn't community spread, so the public shouldn't be panicking at this stage. All of the cases are being managed very well, and obviously we're following up on different contacts and the like. So I think people should be aware, but not alarmed at this stage.
With what you said just then, there has been human-to-human transmission identified in other countries. Is it therefore inevitable here? And when there is human-to-human transmission, is that then time to panic?
Look, I don't think we should be panicking at any time. I think this is the time that we need to prepare for cases that may occur in the future. Yes, you're correct in the sense that there is sustained spread in a number of countries now, particularly in Iran, in South Korea and in northern Italy, and obviously there's still some within China. But I think this is the time that we should be preparing that we will get cases eventually, and again we need to remind people that a lot of these cases will be mild. More than 80% of the cases we would expect to be mild, but some will be serious, and obviously we need to prepare those more serious cases, and that may include some that will end up in our intensive care.
How does that compare? 80% of cases will be mild. How does that compare to the normal flu or to the SARS virus we saw?
Well, they're very different. The normal flu, it is very different from flu. We're seeing it very much. This disease appears to affect the more elderly and those with sort of chronic diseases. We're not seeing it in children almost at all, which is quite different from flu. SARS itself, again, was quite a very serious disease, but didn't spread as easily as this disease does.
Is the fatality rate around 2.5–3%? Is it more than flu?
The fatality rate, it's very hard to gauge the fatality rate at this early stage of the disease. The problem is you get a lot of mild cases that people haven't been tested for, and there may be other things. The best estimates at the moment are the fatality rate is probably between 0.5 and 1%.
Is it possible to say whether the wife contracted the virus from her husband, or is that not able to be said?
It's not like we can't speculate on how the wife got this disease. Both obviously were on the Diamond Princess at the time.
Are there any plans to move her into intensive care at this stage?
She's currently in a negative pressure room. Obviously, she'll be moved to intensive care if and when she requires that, if that is what the disease. It may be that the course of the disease will vary from person to person. So I think obviously that's a clinical decision as to what kind of care she needs.
Does that mean that the incubation period is a bit different to what people first thought, given that she wasn't positive when she first came off the boat?
No, the incubation period is very much. The incubation period is usually between 2 and 10 days. So she was probably, I think, I can't remember exactly, but I think it was probably around 8 days. So that's totally consistent with the incubation period.
Did the trajectory of the man's illness, his deterioration, surprise the people who were treating him? We'd heard earlier in the week that he was stable.
Look, he was stable. I don't think it surprised anybody. We know with this disease is that often they may start out being quite stable and have relatively mild disease early on, but unfortunately the disease seems to progress over the time as it moves from the sort of the upper respiratory tract down into the lower respiratory tract, and it's often the second week where people will deteriorate, unfortunately, and get a significant viral pneumonia. So that's we are aware of that. So we just need to take that into account with all cases.
And is that similar to SARS or the flu, or is that different?
Again, it's a different clinical picture than both SARS and the flu because they are quite different viruses.
As opposed to the panic buying we've seen of hand sanitizer, face masks, what can people practically do at home to protect themselves?
There's a couple of things they can practically do. One is obviously hand hygiene and washing your hands. It's fairly. I know it's fairly simple, but it's sneeze etiquette. So if you are coughing or sneezing, using tissues and disposing of them immediately, or if you haven't got sneezing into your elbow. And the other message that we'll start to put out shortly is, we're expecting that this disease while it may take some time to become established in Australia, may be occurring, during or soon after the flu season, and we would strongly recommend people consider getting a flu vaccine this year, because needless to say, if you have the flu vaccine and the coronavirus at the same time, that's not going to be an ideal situation, and that's one thing you can avoid is by having a flu vaccination.
Are hospitals, GPs reporting any influx of people turning up worried they've got the coronavirus?
Look, I think with any of the reporting that goes on, you can expect that there is going to be an element of worried people who have travelled or who have developed a mild respiratory illness. So yes, I think that is occurring. It's certainly occurring at our hospitals as well. But obviously we do need to be very cognizant that some of them may, if they've been travelling to a number of countries now, may have picked it up, and so we have broadened our testing criteria so that we are testing for coronavirus from a far broader range of countries, including countries like Iran, Italy, South Korea, Indonesia and a number of other countries.
As things stand now, are you confident the hospital system can cope with the added pressure, if it does, when it does hit?
Look, I think at the moment the hospital system is coping well. Obviously part of the planning going forward is how do we best prepare for increased number of cases, and particularly increased number of serious cases going forward, and a lot of our work which has already commenced is planning to how we increase our capacities to deal with these cases.
And at what point, when do we reach the point that football matches have to be cancelled, public transport cancelled? Is it human-to-human transmission?
Obviously, you've probably seen in Italy, that they have looked at the social distancing measures. How do you reduce the spread? Similarly, in China, they've introduced social distancing. There will be a point where that will be a consideration. It may be that there is an outbreak in a certain area with the city, and we feel that we can continue to contain in that area, and we would consider some social distancing measures. We're obviously not at that point yet, but it is a consideration. But there may, depending on the disease, we may, we have to be. We're not going to immediately jump to those assumptions, and we're obviously encouraging people at the moment to continue to go about their normal lives.
Will that be your call? Will you be the person who makes that decision?
It will be obviously done in discussion with the broader health system, but certainly decisions around social distancing and those things will be made by the health department at the time.
You described the possible overlap of flu symptoms and coronavirus symptoms. This would seem to be a very significant complicating factor on the horizon.
One of the things that we are trying to do at this stage is obviously to continue to contain the disease at the moment. So at the moment we're still in a containment phase. If we can continue to contain the disease for a longer period of time, that will stretch out how long it is before we see the peak of the disease coming into Australia. So obviously there are some that may occur around the time of our flu season, or it may be later than that. But
when is the flu season?
It's usually in the sort of July to September region.
Has there been a bit of a language shift in that it's now, you seem to be talking about how long you can contain the disease, not whether you can contain it. So is it inevitable that it can't be contained at some point? There will be human-to-human transmission in Australia.
Look, I think there has been a language shift, and I think that's just the realities of the situation. Obviously, we've been watching the development of the disease around the world. Certainly in mainland China, there's been considerable efforts to control the disease, but it is now spreading. There's obviously community spread in a number of countries, and that is increasing. And so I think we realise at this stage that it is likely that we will get community spread in Australia at some stage in the next, probably in the next 3 to 6 months, and we we obviously need to continue to prepare for that.
Given that the first fatality has been here in Perth, does that mean you call for extra resources, or do you have a particular obligation to the federal government to do certain things? Is there further liaison with the federal government on this?
So we have been working very closely with the federal government and with the other states and territories since the beginning of the outbreak. The Australian Health Protection Principal Committee, which provides a lot of the formal public health advice to the federal government, has been meeting on a daily basis, and that will continue. We work very closely in the development of all of the policies and the plans to make sure that we are consistent across the country, and that we are making sure that that the messaging and the coordination is consistent.
Thank you.